Good morning, folks. Every day, we see stroke in various manifestations. Whether in the emergency room or in the outpatient theater, in one way or the other, we deal with stroke on a daily basis. Either somebody just had one or he's recovering from one, right? And most of the people are at a certain risk. The risk increases, of course, with age, but even young people are at risk for stroke, right? And it is the third leading cause of death and disability after heart attack and cancer, right? So it's an important topic, and we should continue discussion on it on the various aspects, right? Now, I want to talk about something which we call a TIA. It's an acronym short for transient ischemic attack. A transient ischemic attack, as the name implies, it's transient, which means that it doesn't last, right? Whereas a stroke is something which lasts. Basically, that means that in a stroke there is some permanent effect, whereas in the case of TIA, the effect is not uh, permanent. It is there for a while and then it goes away. That's the basic meaning. Otherwise, they don't differ. Whether you have a stroke or a TIA, the importance of the event is not different. Your response should not differ. You should take them both equally seriously because TIAs can lead to stroke. The causes or the reasons, the factors which cause TIA are the same factors which cause stroke. That is the importance of a transient ischemic attack. People who have this, they tell us that I suddenly developed this or that problem, either weakness of a side of the body, the most prominent and typical one, or one half of the face, or a face and a limb, or maybe difficulty in speaking, or difficulty in understanding language, or a vision problem, swallowing problem, different things, depending on which part of the brain is affected. But the difference being that it lasts for a short period. Many people say, okay, I had one in the morning and then I had another one a while later, maybe within an hour's time. And then it becomes a sort of emergency because you know that the underlying mechanism is still there, right? In fact, as we age, the mechanisms become more and more, and the tendency to have a stroke is more. Many people say, okay, I never smoked or drank, I didn't have blood pressure or diabetes, but why did I have a stroke, right? The fact is that stroke is a basic tendency of the human body. It does happen because the underlying mechanisms are what happens to us all the time. And these things increase with each of the factors. So if you smoke or drink or have blood pressure or diabetes, especially if they are not well controlled, you have a higher risk because then they accelerate the process. This is the basic fact about stroke and even TIA. So we should handle them. That is the best we can do. Many people complain, I did everything and I still had a stroke. The only answer we can give is it would have been worse, right? The point is that we have limitations to how much we can do as of now. Things are improving, but we are still living in a slightly primitive world. If you ask me, my own opinion is that we are still handling things with partial knowledge, and science is a work in progress. So we will learn more. But at this point, the best thing is to do whatever is available. Don't neglect your health. Take care of it. Don't think that if your blood pressure is normal, then you can stop your blood pressure medicine. You can maybe, but do it with your doctor's advice. Same with diabetes. Sometimes people can go off medicines, but then that's not for everybody, and it has to be done in a proper way, right? And there are some medicines which you may have to continue for life if you had a stroke, or even if you had a heart attack and then you had background reasons to have stroke, right? Or a TIA. So the point I'm making here is that though people make a big issue that okay, it was TIA, so it doesn't matter, so let me sleep it off, and then I'll go tomorrow in the morning. Maybe you'll not wake up with in the same way, right? A stroke can lead to TIA. I've seen this story unfold so many times that I have to deliver this message, okay? Which is the reason I made this video. And I hope I made some sense. And I hope I can talk in more specific terms based on your comments and your messages, your questions. I can give better answers to your queries. Okay, so do give me your feedback on these things. Thank you, and I'll see you in the next video.